Our other focus, no lessons learned from blossed-up sterilization surgeries in Chhattisgarh that claimed the lives of 14 women. A similar case of apathy and negligence is now being reported from Uttar Pradesh's Chandauli district. Here's an inside look at a sterilization camp at a primary health center in Chandauli. Not a single bed was available for women patients recuperating from the surgeries. We also found that instead of sterilization boiler, gas burners were being used to sterilize stools for procedures, and water for the surgeries was being boiled in the open. This is a clear violation of medical guidelines that need to be followed for all surgical procedures. Headlines today's team found women who had undergone these surgeries lying on the floor of the health center. The ward used for the surgery was dirty with garbage strewn all over.
मैं अपनी पत्नी का ऑपरेशन के लिए यहाँ आया हूँ, लेकिन इस हॉस्पिटल की कंडीशन देख के मेरा तो वो अब मुझे मूड नहीं कर रहा है कि मैं ऑपरेशन कराऊँ और सुरक्षित घर।
क्या दिक्कत है, क्या आपको दिक्कत समझ में आ रही है?
यह है कि इस हॉस्पिटल की कंडीशन बहुत ख़राब है। पेशेंट जो है नीचे सोए हुए हैं, ऑपरेशन करा के आदमी 2 कंधा दे के ले आ रहा है बाहर, और इसकी वजह से मेरा मन तो यहाँ से हट रहा है। इस कंडीशन इस हॉस्पिटल की जो है स्थिति ठीक नहीं है।
जानकारी जो आपके माध्यम से और चैनलों के माध्यम से मिली है कि ये जो जितने हमारे शिविर में आए हुए महिलाएं थीं उनको ज़मीन पे लेटा दिया गया था और स्टेरिलाइजेशन का कार्य जो था वो प्रॉपर ढंग से नहीं हो रहा था। इसकी जांच कराई जा रही है, जांच के बाद जो कार्रवाई होगी की जाएगी।
Let's get a word from Amir Haq, who's with us live this afternoon. Amir, any reaction from the state government?
Well, the local administrative officials have told us that they've ordered an inquiry into the incident, although there is no timeline that they've set for this inquiry report. The government very slowly, in fact, limping towards taking an action against the government officials and doctors involved in this entire incident. But definitely, the Bilaspur incident seemed to have opened up a Pandora's box as far as health services in India is concerned. In fact, over the last 2 days, there have been 2 incidents that have been reported from UP. One from Kushinagar, where a government doctor was was making a record of sorts by operating about 42 women patients for tubectomy in just about 2 hours. And here in Chandauli, we have this latest case where about 50 women were being operated upon while they were still lying in absolutely unhygienic conditions on the hospital floor. So definitely a thorough rethink and a recheck needed by the government, because these government hospitals are the only option before a large cross-section of people, especially the poor ones who need health services. They can't afford to go to private hospitals for their needs. So definitely the state government as well as the central government definitely need to rise up to the occasion.
Amir, thanks so much for that update. We will keep coming back to you for more political reactions. Meanwhile, more politics over the sterilization blotch-up in Chhattisgarh, which is now heating up. Congress Vice President Rahul Gandhi today met families of the women who lost their lives during the sterilization camp organized by the state government in Bilaspur. Alleging medical negligence, Rahul Gandhi blamed the Raman Singh government for the mishap. He also accused the state of not accepting its fault. He also asked for the health minister's resignation.
सच्चाई ये है कि ये सिर्फ लापरवाही का केस नहीं है, यहाँ पे भ्रष्टाचार का भी रोल है, नकली दवाइयों का भी रोल है, और ये सरकार की जिम्मेदारी है। ये जो कैंप यहाँ चलाए गए सही तरीके से नहीं चलाए गए और बहुत सारे लोगों को नुकसान पहुंचा है। दवाइयों को जलाया जा रहा है और इस बात को दबाने की कोशिश की जा रही है।
Now to the latest on the condition of the women. 7 of them are said to be critical. They were put on ventilator support this morning. Meanwhile, the Indian Medical Association has declared a shutdown of clinics and suspension of medical services across Chhattisgarh. Condemning the termination of Dr. R.K. Gupta's service before the completion of probe, the IMA has now demanded the resignation of the state health minister. The state government is under scanner for not revealing the exact cause of death. The report merely mentions shock death and has left the details for a viscera test.